of the shorthand that we've developed for ophthalmology in openEMR. Here's an eye exam for the patient, fictitious patient Jim Sullivan. You could enter the chief complaint, the HPI, just like we would normally, tab through the different fields. But instead, what we want to do is use the shorthand. I'm going to blow this into the full screen mode so it's easier to see. Because there was another window open, this screen is now locked. We need to unlock it so we can actually document in the chart, otherwise we'll be in view-only mode. We want to open the shorthand window, which we can do here. We can also open it or close it from here. Shorthand window can be made larger or smaller. It sits in the front and it can be dragged and moved across the screen. The format of the shorthand is field.text.delimiter. The delimiter is the semicolon. We built in safeguard should you need to use the semicolon as part of the text. But for the most part, try to stick to this format. For the fields, when you look at the form, you can see in red, whenever the shorthand window's open, the forms are labeled for you. So we'll open that, we'll see here's CC, HPI, chronic, 1, 2, 3, etc. So let's start documenting this patient. Chief complaint, we'll do in quotes because it's the patient. My vision is blue. And we're going to end that with a semicolon because that's the end of the chief complaint. The history of present illness is since cataract surgery in the left eye, the patient is complaining that everything has a blue hue, especially the skin. We all know James P. Sullivan, the Monsters Inc. is blue, so that's not unusual. Let's delimit that again. In past medical history, he's a little overweight, he's got diabetes, hypertension, let's see, he's got asthma. What else can we give him? Let's just say chronic renal insufficiency. And for meds, he's on Lasik, 80 milligrams a day. For some reason, he's taking Plaquenil, 3 pills, 600 milligrams a day. We can make him a glaucoma patient with Timol 0.5% gel-forming solution, QHSOU, and he's allergic to penicillin, which gives him hives, and sulfa. What does sulfa do? Let's just say it gives him a rash. For surgeries, he's had an appendectomy in 2000, let's just say a stent in 2007. That should be enough for that area. Let's just document that. Go ahead, enter. We can continue entering into this field continuously as we type, but this is a good place to stop to show you so far what we had. So we just either tab off the field or hit enter. I tabbed off, close the window to look. The chief complaint is filled in. Since cataract surgery in the left eye. What about all the past medical history? Well, we can open the panel, and which is all that had other things filled in as well. These things were added to him. He's a current test patient that we keep adding things into. We can expand this and look. We have diabetes. Now let's delete the diabetes from here. We can also select it here, clicking on it. We'll delete that. Let's open the window again and say that he's a non-insulin dependent diabetic, non-insulin dependent diabetes. I think it's 25 years. Now that's going to go, we want that to go into the past medical history area. So, past medical history, hypertension, asthma, anxiety, chronic renal So it gives you an idea of how powerful it is. Let's look at the clinical component. Now, there's lots of ways to document the clinical exam, but we're showing you the shorthand version here. In the shorthand, the first and most powerful is the D. The clinical areas can be defaulted. By hitting D and enter, all of our fields are filled, all the ones that have defaults. The motility isn't, because that doesn't have a default. None of the alternate cover testing data should be filled in. But 0.0, 0.3, flat macula, 2 or 3 vessels. Let's say there are some positive findings, like on the right upper lid, there's a sty, laterally red and tender. And the left lower lid has an ectropion medially. Also, left lower lid has a 5 millimeter basal cell carcinoma centrally. Now, we want to append that. Notice there's 2 left lower lids. We decided to add something into there. Let's fix the spelling. Left lower lid, ectropion, basically cancer centrally, appended. What will happen with this? ECT and medial will be expanded to ectropion medially. In the left lower eyelid second field, because I added the dot A at the end, will be appended. So let's look at the lower eyelid field. The left lower eyelid, ectropion medial, and a 5 millimeter basal cell carcinoma centrally. Exactly what we wanted. Now, the default is good tone, and that has been erased because let's go back and look. We defaulted here, but everything after that erases that field. Now, had we had changed this to append, it would have appended to the normal as opposed to completely replace it. You can go on through the whole exam and document multiple findings. Any of these fields portions can be filled in using the shorthand technique. Hope that makes a lot of sense, and hopefully we can continue to improve this for the